Now look at this image over here. What you're seeing over here, this bloated structure over here is your cavernous sinus, and two sinuses are present on either side. So these two cavernous sinuses are connected by the intercavernous sinus. Now for our surface marking, it's present in the middle cranial fossa just behind the orbit. So if this is your orbit, you can see these two are your orbits, and the cavernous sinus is lying just behind the orbits in the middle cranial fossa over here. Okay. So they are connected by the intercavernous sinus, and a striking feature over here is that the intercavernous sinus has no valves. So the infection can easily transmit from one sinus to another. It's very free for the infection to communicate from either of the sinuses because of the absence of valves in the intercavernous sinus. And the most important structures passing through the cavernous sinus are, please make a note of all these structures, these will be asked as questions. Okay, the first one, the topmost structure in the cavernous sinus is the oculomotor nerve. Then below it lies the trochlear nerve. Below that are the two branches of our trigeminal nerve, that is a fifth cranial nerve, the ophthalmic nerve and the maxillary nerve. So 3, 4 and 5, that is two branches of the fifth nerve. These are the structures lying laterally in the cavernous sinus. However, in the center lies our internal carotid artery and the sixth cranial nerve. So 3, 4 and 5 are in the lateral wall, and sixth nerve is in the center of the cavernous sinus along with the internal carotid artery. Okay. Now, what are the features of the cavernous sinus thrombosis? As you can assume, the first one is proptosis. Next, the chemosis. Please look at this image. There is severe chemosis of this patient, that is the conjunctiva is severely inflamed along with extraocular muscle paralysis. So these are the clinical features. Now an important question over here, what is the earliest sign of cavernous sinus thrombosis? And your answer will be sixth nerve palsy, the nerve that is in the center of the cavernous sinus, that is going to be affected the earliest when there is cavernous sinus thrombosis, causing what palsy? Sixth nerve supplies the lateral rectus. We all know that, so it will cause a lateral rectus palsy. So you can understand from that the patient will have an exaggerated action of medial rectus causing adduction of the eye. That will be the position of the eye. Then because of the absence of valves in the intercavernous sinus, it will become bilateral within 48 hours. Okay, the cavernous sinus thrombosis, initially even if it is unilateral, it's going to become bilateral in just 2 days. Then it is followed by CNS symptoms of disorientation, drowsiness and coma. Okay, this is a highly fatal disease. It has a fatality ratio of 30 to 40%. So it's a very serious condition and needs immediate treatment with IV antibiotics, IV heparin and steroids. Okay, this is the management of cavernous sinus thrombosis. Now there are a few other conditions which look very similar to what you are seeing in this picture. So they will be your superior orbital fissure syndrome, cavernous sinus syndrome and the orbital apex syndrome. Okay, the differential diagnosis of CST is superior orbital fissure syndrome, the cavernous sinus syndrome and the orbital apex syndrome. Now there is loss of vision due to optic nerve involvement in orbital apex syndrome. So this differentiates it from superior orbital fissure syndrome and cavernous sinus syndrome. So when there is visual loss, you should think about orbital apex syndrome.
Hello everyone, this is Dr. Sai Suguna, your mentor for ophthalmology at Medicoapps. Now, thanks for watching the video. Now we have put such videos all together in our ophthalmology app. The trial version you can download from the link over here or in the description box below.